Welcome to the I.D.E.A.S Clinical Education, formerly CCO, Infectious Disease Podcast. I'm your host, Dr. Karen Straube-West. In today's episode, we will explore how molecular point-of-care testing might mitigate the impact of sexually transmitted infections on personal and public health. To listen to other podcasts in this series, please visit the show notes. Now let's get started.
Hi, my name is Dr. Jeffrey Klausner. I'm a professor of medicine and public health at the University of Southern California, Keck School of Medicine. Today, I'm going to talk about the advantages in sexually transmitted infection screening at the point of care. Sexually transmitted infections like chlamydia, Neisseria gonorrhea, Trichomonas vaginalis, and Mycoplasma genitalium remain very common in the United States, and in fact, are on the rise. If not diagnosed and treated, those infections can have substantial impact on personal and public health. STIs can cause chronic lower abdominal pain, pelvic inflammatory disease, infertility, and complications during pregnancy and in the newborn. A key strategy to prevent progression to serious disease is screening. The CDC and U.S. Preventive Services Task Force recommend routine screening for chlamydia trachomatis and Neisseria gonorrhea in pregnancy, young sexually active women aged 25 years or less, and in those 25 years or older with certain risk factors, such as more than one sex partner in the past 12 months or the exchange of money or drugs for sex. At present, there are no recommendations for routine screening for Trichomonas vaginalis or Mycoplasma genitalium due to insufficient evidence of population benefit, although this could always change as new data are found. Historically, STIs were detected by laboratory-based culture. Beginning in the 1990s and early 2000s, laboratory-based nucleic acid or DNA amplification tests were developed based on the polymerase chain reaction or PCR. Such tests were groundbreaking in terms of increased accuracy, sensitivity, and the ability to test urine and a variety of specimen types, including self-collected vaginal specimens. Nucleic acid-based testing is primarily performed in hospital-based or large commercial laboratories where results can be provided in a few days to a week. However, because of that long turnaround time, when a patient presents with symptoms of an STI, such as complaints of genital discharge, burning with urination, bleeding, or pain with sex, most healthcare professionals will treat empirically with several different antibiotics that address the most common curable infections. That empiric treatment is highly effective, but results in antibiotic overuse, increased cost, increased antibiotic-related side effects, and increased concerns for the development of antibiotic-resistant infections. In fact, the CDC has declared antibiotic-resistant Neisseria gonorrhea an urgent threat. The situation is so dire that the U.S. is down to just one reliable antibiotic for first-line treatment, ceftriaxone by injection. It is worrisome that in many parts of the world, like Southeast Asia and parts of China, between 10 and 30% of gonorrhea infections are ceftriaxone resistant. The loss of effective antibiotic treatment for gonorrhea would be devastating on a global scale, resulting in a return to the pre-antibiotic era when serious complications due to gonorrhea were common. Given the challenges with the turnaround time in laboratory-based STI testing and the advances in target capture, readout technology, and the miniaturization of assay components, diagnostic test manufacturers have been developing and producing new rapid, less than 30-minute point-of-care tests. Currently, there are 4 FDA-approved products that may be used at the point of care, with 3 of the 4 assays producing results in less than 30 minutes. Those point-of-care tests are highly accurate with similar sensitivity and specificity as laboratory-based nucleic acid detection tests. Some are even Clinical Laboratory Improvement Act or CLIA waived, which means that the tests can be performed by a trained medical assistant in a CLIA waived settings. Current FDA-approved point-of-care molecular tests, including tests made by Cepheid, called the Cepheid Expert, by Binks or the Binks IO, Visby Medical, and the Roche Cobas Liat. The advantages of rapid point-of-care molecular testing are numerous. Historically, even at the best resource clinics, off-site testing took days to produce results, resulting up to 20% of people with infections not being treated. Even with better partner notification and follow-up systems, many people with positive screening tests do not return for treatment. Point-of-care testing allows for STI screening at community-based organizations and in field settings like schools, health fairs, or in detention facilities. Most recently, a test for chlamydia and gonorrhea and trichomonas was approved for home self-testing in females. Recent studies implementing rapid point-of-care molecular testing in sexual health clinics and emergency department settings show that testing and providing results during a clinical visit greatly reduces the time to treatment from an average of 8 days to less than 1 day in one study, reduces excess antibiotic use, decreases potential antibiotic-associated side effects, and increases the number of people correctly treated. Providing timely results offers a direct opportunity for infection-specific education and counseling, in addition to the opportunity for expedited partner therapy, where one provides extra medication to give to a patient to give to their recent sex partner. Furthermore, rapid point-of-care testing saves substantial staff time that would otherwise be spent on patient notification and follow-up of a positive test result and scheduling a repeat treatment visit. One substantial barrier to the increased implementation of point-of-care STI testing is reimbursement. In the U.S., most third-party payers make no distinction between laboratory and point-of-care based testing, providing reimbursement below or at the cost of a point-of-care test. This is because laboratory-based testing is performed in batches of specimens on high-throughput equipment, so the cost per test are lower than individual tests on a point-of-care system. Although point-of-care STI testing may provide better clinical care and outcomes for patients and may be preferred by medical providers and public health officials, reimbursement is not typically determined by value, but by the complexity of the test. It is ironic that as molecular tests become simpler and easier to use, the reimbursement might actually decrease. But if clinical sites realize that point-of-care tests are cost-saving in terms of reduced staff time and increased overall revenue, with better medical care resulting in more patient demand for services, then limitations in reimbursement would be offset, thereby making point-of-care testing financially feasible. Other options to increase reimbursement might be if manufacturers produce more complex multiplex tests with more targets, including targets for pathogen-specific antimicrobial resistance markers. Such new assays would have even further clinical and public health benefits, including increased pathogen screening and the ability to diversify treatment and provide specific resistant guided therapy. The revolution in diagnostic testing with the advent of molecular testing for STIs has enabled highly accurate rapid point-of-care testing with the results in less than 30 minutes, and even self-testing within the privacy of one's home. Provision of a same-visit test result also improves clinical care, improves patient satisfaction, and may reduce complications. From a public health perspective, molecular testing is critical for STI prevention because more people with infections are treated and treated faster, reducing the spread of new infections and limiting the development of further antimicrobial resistance. I want to thank you very much for listening today, and I hope you enjoyed today's discussion.
Thank you, Dr. Klausner, and many thanks to you, our listeners, for joining us. To view the full program on state-of-the-art strategies for today's challenges in HIV and STI care, please click the link in the show notes. To get access to all of our new podcasts, subscribe to the I.D.E.A.S Clinical Education, formerly CCO, Infectious Disease podcast on Apple Podcasts, Google Podcasts, or Spotify. Thank you, and have a great day.